The Frontida team reminds me a lot of floating doctors in the early days, where it's a lot of people coming together around the same idea, not receiving much in the way of compensation, receiving a lot of hard work and a huge number of challenges, and essentially deciding none of them are impossible to overcome. And so that's kind of my impression of Frontida. It's a group of people who have a vision and refuse to accept that, the barriers that people would assume, would stand in front of that vision are insurmountable. So the impact of something like this on floating doctors, or even like any other organization doing this kind of work, it's really almost unquantifiable. You've got the ability to do surveillance on our programs much more effectively to ensure that what we're doing is actually working, that we're meeting our goals. It gives us the ability to surveil, emergent health issues in real time. So if there's spikes in tuberculosis in one community, we'll probably know about it right away without having to go mine through our paper records and hope that we can identify these trends. It'll allow us to actually analyze a huge amount of data, not just what we were able to collect previously on paper, but also the additional data that we're able to hold in a digital space. The standard of care should improve because this EMR is specifically designed to help ensure a better standard of care by short-term providers from many different health systems and backgrounds. I mean, I could just keep going and going. If we needed to obtain in-kind support from an organization that needed clear metrics of what the need was and what our impact was, that now we can actually generate that data. Previously this was sitting down with giant stacks of paper records, going through them, hoping you could somehow make sense of the patterns and trends. Now it's going to be a few pushes of a few buttons. The ability to take pictures, of ultrasound images or skin lesions or other issues and upload them to a patient's chart so that they can be reviewed later or compared to a subsequent visit. I mean, it just goes on and on. This would be helpful for us in reporting to the Ministry of Health and letting them know what we're doing, and also being able to give them data about regions for which they have no current data. I was thinking about what this kind of data reporting actually means. And first I was thinking about it in terms mostly of our own research, what we could learn, what we could share with other people, the insights that we could gain. But I think it's actually broader than that. As the rest of the world moves to EMR and health policy is developed, most of that health policy is, of course, global health policy is mostly developed from health information. Most health information comes from EMRs. Frankly, countries that are on paper record systems, often that data just isn't able to make it into global data collections from which global health policies are made. And what that really means is huge swaths of the Earth's population that live in areas where, any records that are, about their health are on paper, they're not being counted, when people are developing these global health policies. They have no voice. What electronic data like this for regions like this really means is suddenly all of our indigenous patients now have a voice when health policy is being made. Their voice is going to be counted. They're not going to be ignored and passed over because it's so easy to look at electronic health data and just ignore the fact that in various hospitals there might be a big stack of paperwork that no one's bothering to go and count and add. So that to me is really what this does. This gives a voice to the voiceless. And since everything that we're about is trying to close health access gaps, to close technology gaps, to close enfranchisement gaps, being able to have our patients actually count when resources are being handed out, when policies are being made that are going to affect their lives, like that's what this EMR does.